Oni. Hope your day was fine, just like I said. You are all welcome. Felicia, Bella, Bello, Mustafa, Inaini, Duna Sanda Arewachi. Una Shigo Wadwala Kudambani likes. As you are coming in, please tap on your screen and give me a like. God bless you as you do so. So just like I said, today's live streaming will be on preparing your body for a smooth and safe delivery. For my gorgeous preggy mamas, you know I love you. And I always make sure I come to give you the best. I pray that we enjoy this lesson. It's a very interesting topic. Anyway, if you are new here, I am the Fashionable Midwife. I talk about pregnancy, about newborn baby, about antenatal, about postpartum, about family planning, about so many things that has to do with the woman and her husband and the children and the whole family as a whole. So, you are all welcome, my beautiful, gorgeous mama. You know, anytime I come online, you know, I'll say, hello, my gorgeous, preggy mamas. You will see some people will be jealous that every time is the only the woman you'll be talking about. Maybe she has a husband too. I say, okay, I'm not disputing that. So, just like I told you, I am a midwife and a birth coach. I worked in Kebbi State for like 30 years, and through all the time I worked in antenatal clinic and maternity wards. I'm a registered nurse midwife, but I've always been posted to either maternity ward or antenatal clinic. In fact, I retired as the chief matron of my antenatal clinic of Mataba Meyi General Hospital in Zuru, Kebbi State, because I left there 3 years after my husband died. I came back to Lagos and I retired voluntarily. But even at that time, I had worked for over 28 years. But I qualified in March 1990 from School of Midwifery, Ekwa Egbe, Kogi State, formerly under Kwara State. So, if you are new here, that is me. Thank you for coming this night. So that's the brief introduction. Like I said, I talk about so many things that has to do with family. So, and I told you that my topic this night is preparing your body for a smooth and safe delivery. So what are we going to learn this night? You know, when I come, I always teach into details. So this night, we are going to be learning how you can prepare your body for your physical preparation. You know, I said preparing your body for a smooth and a safe delivery. So we'll talk about physical preparation. We'll talk about mental preparation. We'll talk about nutrition. It's very important. Pelvic floor and the exercises you can do. Birth plan. Warning signs. Then if you have questions, we can do questions and answers. So if you are pregnant here, you can drop your due dates. I know that in Africa, we are always afraid, but whatever it is, even if you want to drop it, your EDD is covered with the blood of Jesus. So you don't have anything to fear. So as a pregnant woman, you need to understand your body, you know, in late pregnancy. In the first trimester, just like I used to say anytime I talk about pregnancy, first trimester is difficult for so many people because of the nausea and vomiting. Please give me some like if you're on this line, on this live stream, please. As you call me, just tap on your screen and like. This like means a lot to us if you are doing live stream, because it will make more people to see you and they will come and listen. Visibility, it matters a lot. So the first trimester is terrible for most women. They will be sick, they can't eat, vomiting, sleeping, spitting. Some even go as far as carrying a container for their spit. Even me, anytime I was at that time, anytime I was pregnant, I spit a lot. You will see me everywhere. I'll be carrying my container of spit. Why some other women, they don't feel that. As soon as they are pregnant, in fact, you will think they are giving them ogogoro, the kind of strength they will have. But that percentage is very low. Most women, the first trimester is always a big problem. Thank you for the like. God bless you. So it's always a big problem. You see a lot of them will be sick. Like me, my first pregnancy. I saw Oba. I will vomit and vomit and vomit. Though my late husband was a medical doctor, he will set, sometimes when I was to go for morning duty, he will set drip for me before I would go for my duty. I was working at the General Hospital Yawori then. Hello, Chijoke. Good evening. Hello. Hi. Good evening. You are welcome. So you have to know your body very well, because so many things changes during pregnancy and during the later part of that pregnancy also. So many things will be changing in your body. Like, towards the end of pregnancy, when labor is about to start, you will see that your cervix will become we start softening. We call it effacement of the cervix. So the cervix will be softening and very thin. That shows the cervix is getting ready for labor, because when the pregnancy is 38, 39, 40 weeks, the body knows that this baby is ready to come out. And the way God does this thing, the body also will be reacting in some of the things, some parts of the body. The cervix is where the baby's head will come out from, because some people may not know. And this cervix, we have the external host and we have the internal host. It's the internal host that will first of all start to dilate before the external external host dilates. Internal host and external host. So is the internal host will first of all be effaced, and it will start thinning out. It's one of the signs of labor. And also, during the late pregnancy, if you look at a woman's bump, some people, their tummy is very big. But towards the later part of pregnancy, you will see that the baby drops lower into the pelvis. We call it the engagement of the feta, of the presenting part. So you will see, even the woman will notice it, because when the pregnancy is still very big, it will even be affecting her breathing, because the pregnancy, the pressure will be here. But now the pressure will be down because the baby's head has engaged. So she will feel a bit lighter. She will know that, yes, my body is now getting set to have this baby. Then we have this Braxton Hicks versus recontractions. How will you know the differences? Braxton Hicks, is very common during pregnancy. You'll be feeling as if it's labor, but it's not labor. But the recontraction, you will see that you said you don't have to be told, you will know, because you must have been taught in the antenatal clinic, in the clinic, that this is how to recognize the recontraction, because it will be first when it starts, it may not be regular. Later it will become regular, it will become intense, and it lasts longer. But in Braxton Hicks, the difference is there's just mild contraction sometimes when the baby, kicks, you feel that. But the recontraction and other signs of labor will show that, yes, this is the time that the labor wants to start. And when this recontraction starts, the woman can see show. It's a mucoid substance mixed with slight blood that will drop. The woman will know. Some women can even drain a bit, So when you see all these signs, you know that, yes, your body is ready. So you should learn to study your body towards the later part of your pregnancy. And that is why I always emphasize on the importance of antenatal clinic as a pregnant woman. It's not something that you have to joke with. When they give you appointment, please go at right time. If you have any complaint, you can complain to your midwife, and treatment will be given to you as soon as possible. Because as a pregnant woman, we don't joke with whatever complaints you may have. So antenatal clinic is where you go and listen to health talk, where you take your medications, where they check your blood pressure, they check your baby's fetal heart, they check your fundal height to see the time you told us that you missed your period, does it correspond with all this examination they are doing for you. If there are lab investigations to be done, maybe you have to do some blood work, PCV, HB, white blood cell count, whatever it is, you have to go to the hospital. Nobody will come and meet you at home. You need to register for antenatal clinic as soon. In fact, some people even 3 months they start ANC, but at least 16 weeks, that's 4 months of your pregnancy, you have to start going to antenatal clinic. Is very important. So you have to have this at the back of your mind. And if you are the husband of a pregnant woman, please allow her to start antenatal clinic, because it's for her own good and the growing baby in her womb. So why is preparation important? Just like the topic said, that preparing your body for a safe delivery. Why is it important for the woman to prepare before labor starts? Because this will reduce, especially for the first time mom, this will reduce the fear of labor. There was a time I talked about some pregnant women being scared of everything. They worry so much. This baby, this my pregnancy, I hope my baby is normal, I hope I'll be able to deliver this baby, I hope I will not have CS. So if they are always scared, and it's natural for a first time mom to feel that way, because she has never done this before. Even the one that has had children before, some of us will still get scared, because labor does not come the same way. The way you deliver David may be different from the way you are going to deliver Zara. The way you feel, so nobody can actually tell you that this is the way labor pains feels, except when you experience it yourself. There's no way I want to describe it for it's painful. Just like people says that the person that wears the shoes knows where it pinches more. So there's no way I want to describe labor pain for you that you understand until when you get pregnant and feel it. I had a story that time that when the girl was the first time mom, she was telling her mom that, mommy, how will it be? Mommy told her, don't worry. When that day comes like this, you just sleep. By the time you wake up, you will see the baby by your side. She said, really? The mother said, I don't want to scare you. Just wait when the time comes. So when she started feeling it, she said, mommy, this thing is painful. The mother said, really? It's just starting. You just have to be strong. That was how you came. That was how I went through this. And thank God you are experiencing it, but I'm going to support you, but you have to be very strong. So the mother supported her daughter emotionally, and eventually she gave birth. And she said, mommy, you mean you went through this? Oh, mommy, I'm so sorry for all the stress I used to give you. In any way that I might have disrespected or disobeyed you, mommy, I'm so sorry. She hugged her mom, and the mother was very happy. So until you experience it, you can't really say this is how it feels. You need to experience it before you can know what it means. Chijoke Chinedu, thank you for staying around. Feshat Akio, thank you. Thank you. I appreciate you guys. Thank you. Then when you prepare for your body for a smooth and safe delivery, you need to minimize. This also help in minimizing complications, because we must have told you anytime you come to antenatal clinic that this is normal, this is not normal. So anytime you see that you are feeling, and I used to say it even on the live stream, that anything that you feel that is off, that this is not normal, there's nothing wrong in you even having the number of your midwife. You can call her and tell her that this is what I'm feeling. She can tell you to please come to the hospital. And I also used to say that even if you are attending antenatal clinic regularly, and maybe the last time you went, they say you should come back in 4 weeks' time. But that doesn't mean that you have to stay till that 4 weeks if you have any complaint. If something is wrong with you or you are not feeling good, don't wait till that 4 weeks. You can go and see your midwife or your doctor anytime. I'm from Nigeria. Thank you. I'm in Lagos, Nigeria. I'm live streaming from Lagos, Nigeria. Thank you. Ferhat Ake. What about you? You can just drop it where you are watching from. Thank you so much. So, it's very important. Don't say, oh, from USA. Okay. No, Nigeria. I didn't say Algeria. Nigeria. Lagos, Nigeria. Yes, that's where I'm streaming from. So it's very important for you to know all these things. When you prepare and you feel any sign of complications, you have to go and see your midwife. So preparation helps in minimizing complication. Then it helps with faster recovery. Like maybe a woman now, maybe you are going to have elective CS. They might have told you that is what is under birth plan, that this your baby will be through elective, we call that elective cesarean section, because you have been pre-informed, not emergency CS. Emergency CS is maybe you have complications. You can even be in the labor room and they see that you have complications. To save the life of the baby and your life, they can prepare you, quickly to go and have CS. But when it is elective CS, you must have been pre-informed. You have known that you are going to have CS, and so your mind is already prepared. And this will also help you, to get your healing, to recover very fast. And if it's spontaneous vaginal delivery also, from the antenatal clinic, from everything you have been hearing, this will also help in helping you to recover fast. Because that you deliver through vaginal does not mean that we know it's normal, but then your body still have to recover. You have to do so many things, some exercises, to take good food, to relax, to make your body go back to its former state before you got pregnant. So, pregnancy nutrition for a smooth delivery. There are some food that you have to take that supports a healthy labor. And I always emphasize it, even as a pregnant woman, that you have to take balanced diet. You have to eat very well. You don't have to be a millionaire before you can eat, food that is balanced, food that will help you and your baby. And you know that whatever you eat as a mother is what that baby inside your womb will also enjoy. So you need to eat very well. You need to take adequate food nutrients that will help you and your baby. Because whatever you take, your baby gets it through the placenta, to the cord, and to that baby. So you need to feed very well. It's very important. So there are some of these food that support a healthy labor, like we have protein, we have eggs, we have fish, we have lean meat, we have beans. All these protein, they are very important, during pregnancy. Very, very important. Then we have some complex carbs like whole grains, sweet potatoes. We need carbohydrate for energy. As you need it, your baby also needs it, which is very important. Okay, you are watching from Algeria. Okay, thank you. I welcome everyone. God bless you for checking in, and I hope you are enjoying it. Please, you can drop a comment that you love this live streaming. Thank you for all the likes. God bless you. So we also have healthy fats. Avocado is very nice. Me, I even love avocado so much. I can spread it on my bread. Anything that will make you to be healthy is very important. So avocado is good in preparing your body for a smooth delivery. Nuts and omega-3 foods, cashew and some other nuts, peanuts is very good. Then we have hydration. I always talk about that. You have to be well hydrated. You have to take like 6 to 8 cups of water in a day. You hydrate as much as it is good for your body. Then dates, thank you for the like, God bless you. Then dates from 36 weeks support cervical ripening. These dates is very good. When you take it, it will help. From 36 weeks, will help your cervix to ripen, so that when labor starts, to be help you to be faster in ripening your cervix. Then we have raspberry leaf tea from 34 to 36 weeks. This helps to tone the uterus. I've been hearing about this raspberry tea. It's very effective. It will help your uterus to be well toned. And when it is well toned, when contraction comes, it will help you to contract very well. And when you are contracting very well and your cervix dilates accordingly, that labor will be smooth. You won't have to go through so much stress. Like me, when I had my daughter, I spent almost 48 hours. I had cervical dystocia. I was having contraction, but I was not dilating accordingly. In fact, they had booked me for CS. I went to the hospital Friday morning. I was there throughout. Saturday, I was there throughout because there was no reason for CS. The fetal heart was okay, and I was okay too. In fact, I was, smashing my amala and tea. So, but the doctor now said that if I didn't deliver that Saturday through Sunday morning, they will come in the morning to do CS for me. He had agreed with my late husband. But fortunately for me, in the night around to 2, my water broke. I had oxytocin drip. I was induced, and later I had my baby around 1:48 or 1:49 a.m. in the morning. So that is, but you see this date, when you eat it very well during the latter part of your pregnancy, it supports cervical ripening. Then there are some food also that you should avoid. You should avoid extremely sugary food. Should be avoided when your pregnancy is at the later part of it. Excess salt. Normally, excess of anything is bad. Salt is not, even if you are not pregnant, and salt does not have much nutritional value in your body. So you should avoid excess. It's either you use Maggi or you use salt. But some people will put plenty salt. They will put plenty Maggi. No, it is not good for you. And something that is extremely too sweet, sugar. Even people that are not pregnant, we always at a certain age, we reduce. Like me, this morning I took tea. I took a green tea. Sometimes I take a Lipton without any sugar. But once in a while, I do take sugar, especially if I want to take, because I like taking garri. So I can put small sugar there. But it's not something that I take it in excess, because it's not good. Because I know I'm not getting younger. So I'm always very careful in whatever I ingest into my body. So please, extremely sugary foods, excess salt, unpasteurized dairy, please, in fact, avoid it at the later part of your pregnancy. It's not good. The raw fish, anyway, I think that salmon fish, when I traveled to Canada, I heard that some people, there's a way they prepare that they will just eat it raw. I said, I can't eat it though. So avoid raw fish. Heavy oily meats slows digestion in late pregnancy. You want to fry plantain, you want to fry egg, you put plenty oil. It's not advisable for you during the later part of your pregnancy to take so much heavy oil, because this slows digestion in late pregnancy. Then there are some supplements that you have to discuss with your doctor, like iron. All this medication, we give it in the maternity ward. We give Fasolate, we give prenatal vitamins, calcium for the bone development, folic acid for the spine and neural tube development, omega-3. All this medication, there are some we give you in the hospital. There are some that you can buy. If you ask your doctor, you say, one thing I want you to know, that in pregnancy, self-medication is wrong. In fact, even if you are not pregnant, because you can't say because your neighbor, when she was pregnant, these are the medication she took. No, our body differs from each other. So you don't have to do what the other person is doing. Make sure you consult your doctor or your midwife that, can I take this? Can I take that? Don't just go to the pharmacy or chemist and start buying medication because someone told you that it's good for pregnant women and you start taking it. Please be very careful, because that baby is still developing. Anything can happen. You see some people will deliver, the baby may not have one eye, the baby one part of the body may be missing, because that time she was taking some medication, the baby is still under formation. The baby is still developing, and you are taking so many drugs that were not prescribed for you by the doctor. There are some medication that you can't take in the first trimester. There are some you can't take during the second trimester. So whatever it is that is disturbing you, please go and see your doctor. Let the prescription come from the doctor or your midwife, because they know the one you can take, they know the ones you cannot take. But if you just go to the pharmacy or the clinic or the chemist, please don't do that, because of your growing baby. The baby is still very fragile. The lungs are still developing. Don't cause deformity for your unborn baby, because when you deliver that child, you will not be happy. And you have carried this child for 9 months, so the baby needs you, and you too, you need the baby. And so also there are some body preparation and exercise. We have some daily exercise like walking. It increased stamina for labor. In going for labor is a vigorous thing. So you need all the power, you need all the stamina that will take you into that favor room and labor room. So in the evening, you can go around your neighborhood, walking, getting some exercise. Even if it's just 30 minutes, is okay. Even if it's 10 minutes, at least you are doing it and it's regular. So this will increase your stamina for labor. Even in your house, within your house, there are some exercises you can do that if you don't want to go far. Like me during that time, my EDD was November 21, but I didn't deliver until November 29. So my daughter's birthday is just a few days. She'll be celebrating her birthday. This daughter that I'm talking, she's married though. She's grown up. So many exercises that you can do that will help you. Then we have some pelvic tilts. It helps baby get into optimal position. There are some pelvic exercises that you can do, like putting your two hands on the floor and doing some exercise. This will help the baby's head to get into the right place, into the optimal position, so that when labor starts, the baby will come out without any problem. Then we have deep squats. This open the pelvis. The pelvis, there are some women that, especially those short women, you will see that most of them, they do CS for them before they can have their baby, because there's what we call cephalopelvic disproportion. Let's say this is the baby. If the her pelvis is small and the baby is bigger than that place, there's no way she will deliver. So you see that some women, their delivery is always through cesarean section. Even if not 3, everything will be true. You will see some of these ladies, their shoe size is always very small. So you know that this one, there's CPD. And with some other things that they will do before they conclude that it is CPD. Then we also have butterfly stretch. Relaxes inner thighs and pelvis. You just do like this. You widen your laps, and this will help your pelvis and your inner thighs. Then we have cat-cow stretch. It eases back pain and encourage baby to face downward. The normal position that is very common when a woman wants to deliver, we call it vertex or cephalic. The head will be down, the head of the baby will be down, the legs are up, and the baby will be well flexed. So as the contraction, the contraction starts from the upper part of the uterus. As it's contracting, and this head is on the internal os, with that force of that contraction, the uterus will be, the cervix, internal os will be dilating, and the baby will be going down slowly by slowly. And that is why we as midwife, we examine the woman every 4 hours. We do vaginal examination to see how she's dilating, that it is corresponding with that contraction, because there's a way we monitor the duration, we monitor the strength of the contraction to know that this labor is progressing. In fact, at that time we used to use something called pathograph, that we have to chart the strength, the duration, all those things, so that the labor will be well monitored. And if you discover that there are some things that is not going normal, we call the attention of the doctor. If it's a case that the baby is having asphyxia, because we'll be checking also the baby's fetal heart. And I've said it on this live stream one time that the normal fetal heart rate is between 110 to 160 beats per minute. So if the midwife checks and she sees that the thing is dropping or is very fast, that means the baby is at risk. So we can schedule an emergency cesarean section. So we have also pelvic floor exercise. We call it Kegels. Pelvic floor exercises. This strengthens the muscle for childbirth. We have muscles, in the pelvic area that help as the woman is, they say push. Those muscles will help her. So we need to strengthen that muscle for childbirth. And this also helps prevent tearing. Though if we, as a midwife that has experience, if you see that this woman, as she's pushing, she's going to be turned. There's a way we can use, we can do episiotomy for her. We don't like giving it, but in some cases that we see that if we don't give that episiotomy, she can tear badly. So it's better for you to give episiotomy than for her to have a ragged tear that will be difficult to stitch. Because if you give that episiotomy, it's a medial line straight like this, and by the time you want to suture, you will suture it and it will be very neat. Only God knows how many episiotomy I've sutured in my life. In fact, some of the children I delivered when I was working in Kebbi State, so many of them, they have graduated from the university, and I'm a proud midwife. The one is even very close to me, Glory. Every time, say, Mommy, I've graduated. I was so happy, and she's an orphan now. Her parents died. So all these things give me joy. Like today, I share about my life on the Blue app that when I was in Kebbi, because I worked in rural area from one local hospital to the other villages. And experiences in this midwifery study is this midwifery job is very common in the rural area, in the northern area, because you will see some cases that you never know that you can see that kind of case. We saw it there when I was working there, because I worked in rural areas from one village to the other. But I love it. At a point, they call me the the lady with the lamp, because there was no lights, and anytime they bring a labor case, they'll come and wake me at home. I'll carry my lamp and follow them to go and take care of the woman in labor. And they love me. They love me, honestly. Kebbi State. It's been almost 7 years now that I left that place, but I still communicate with them anyways. Shout out to Kebbi State Ministry of Health. Thank you. So, I said the Kegel pelvic floor exercise prevents tearing. Then it aids recovery after delivery. It will help tone the muscles, the pelvic muscles very well. After delivery, everything will go back to normal. Even when you have episiotomy, it will make it to heal in time, because you've been doing these exercises even before you had your baby. Then we have perineal massage from 38 weeks. This reduces risk of tears and it increases elasticity. Perineal massage, when the woman, she can do it by herself, and massaging her perineal area reduces the risk of tears and increases elasticity. When the baby wants to come out, everywhere will have to be opened. So if she has been doing this perineal massage, the place, the elasticity will be increased, and there will be low risk of her getting any tear. So then we also have mental and emotional preparation for labor and smooth delivery. Mental and emotional preparation. This is also very important. You have to manage fear. How do we manage fear? As a first-time mom, I told you that some of them, what if my baby did not come out alive? What if my baby is this? What if my baby is that? They are so overwhelmed with fear and anxiety. You can't really blame them, because this is the first time she's doing it. And most of us, even when you are doing something for the first time, it's always like that. Maybe you are going for a job interview that you have never been there before. You will be scared. What will they ask? You see, some of them will be sweating on the hand. Some of them is so bad that they need to be sedated and go and see a therapist for her to calm down. So we have to manage fear. We have to explain fear, tension, and pain cycle. We have to tell her that there's nothing wrong in you, being anxious, but don't allow it to overwhelm you. Don't allow it to take sleep from your eyes, that you are so worried that something you don't have power over. You just leave it for God. At least all of us, whether a Christian or a Muslim, we believe that there's a supreme being up there. And this pregnancy, yes, science is, yes, we know that the sperm fertilized the egg and now you are pregnant, but it is still God that allowed that to happen. So whatever you don't have power over, please don't worry about it, because worries will not solve any problem. Worries will not change anything, but just be very optimistic and be positive about everything in your life, and you will see that things will get better. So you have to allow you have to, from fear to tension and pain circle, it is not the best, because as much as you are getting afraid, you'll be tensed up. And this can also make things to be worse, because of that tension in your body, you even feel the labor pains more than somebody that is well relaxed. So this is very important, you know. Then I would also like to tell you that, relaxation helps labor progresses. You are already having contraction, or you know that you have contraction. Even if you don't know how it feels, you have seen a woman that there's no way, as a girl, you never see somebody that was trying to deliver. You see the way. I remember when I was doing my midwifery, the first delivery that I watched with my matron, as my matron was telling that woman to push, I was helping her to push. My matron said, "You better don't shit for body. Are you the one in labor?" And I was doing it involuntarily. It wasn't intentional. They said, "Oh, yeah, now push me to have the it was so funny. So I have to tell you that you have to relax, because relaxation helps labor progresses. The more relaxed you are, the more everything will go smoothly, and you will have your baby in no time. And you know the funniest thing, God is so great that as soon as that baby comes out, honestly, all the pains that you have experienced, you will forget it. That is, as soon as you set your eyes on your baby, if not, no woman will go near her husband and get that, I want to get pregnant again. I want to go and have another baby. You will be scared. You will never go. But we still go. And some will even get pregnant before that baby clocks 1 year. I've seen so many people, even 4 months. The baby is just 4 months. She's already pregnant. She has forgotten when she was doing. She has forgotten that, and she's now pregnant again. So you have to be relaxed. That's why when you come to the hospital to prepare you emotionally, we teach you how to do deep breathing. Because when you see some women, they are very good at that. Just take a deep breath. So that helps a lot. Visualization. Visualize it that this labor, I'm going to have my baby. Nothing will happen. Positive affirmation. My body is built for birth. I am going to have my baby. Like the Hebrew women. For we Christians, we always say that. This baby, I am going to deliver like the Hebrew women. My body is built for birth. My mommy gave birth to me, and I'm here, and I'm going to give birth to my baby without any complication. So positive affirmation also helps you a lot, to overcome this fear. Positive affirmation. Even you see people teaching their children positive affirmation. I am kind, I am beautiful, I am loved, I am strong, I can do all things through Christ who strengthens me. No matter age that you have, we all need that positive affirmations, because at a point in our life, we have something that we are scared of. We have so many things that we are hoping and praying to God, to get. But the devil also will be telling you that you think you can get that thing. But with this positive affirmation, your faith will be very strong, and you will see that in no time, all these things, without you even noticing it, you will see that God has done everything for you without any stress. So it's very good to always say this positive affirmation. Then you also have to build a support system. You have to choose a calm birth partner. Your husband, in some countries, they allow their husband to follow them to the labor room. And some people can say, let my mommy stay with me. I prefer my mom, because some pregnant women, they don't even want to see their husband. Though even in my country, Nigeria too, there are some hospitals now, they allow the husband to enter. But some people, their culture, the men may not even want to come. Like in the north, I've never seen a man follow the wife to the labor room. No, they don't do that. You just drop the wife and say, Malama, let me go and do this and the other. I will come back. Sometime before the man comes back, the woman would have delivered. So it also depends on the culture. So choose a calm back partner, somebody that will support you emotionally, somebody that will help you to rub your back, somebody that will hold your hand, somebody that will pray with you and say, these two shall pass. Don't worry, everything will be fine. Then you decide who will be with you also in the labor room. Okay, that calm partner maybe So I remember one Christmas like that in Kebbi State. That Christmas, I didn't do Christmas, but I know that I was alive. I shall thank God. But I was in my labor room from morning till night because I had like six labor cases on Christmas Day. So if I check them, the one I will, because we lived in the hospital premises, I will run to the house to go and check my chickens, to go and nobody. It was only me and my husband, and he cannot do the whole thing. So I'll just tell him, I do this. I'll go back to the labor room until night before I was free. So if as you can look at this one and say, she's calm, you can be gisting with her. Then also decide who will be within the labor. I've said that. Then pack your hospital bag early. Don't wait until when you start having contraction before you pack your hospital bag. No, you don't do that. You packed it and keep it that. You know that this is my last 3 months, the third trimester. So you have to start packing your baby things, the things that, because they must have told you in the hospital, these are the things you are going to bring. So make sure you have packed the bag very well, or the box, and keep it aside so that when it is time, you just ask your partner to carry the box or the bag. Then you start going to the hospital. That's how it's been done. Don't have to wait till the. Then sleep and stress management. During the later part of your pregnancy, you need to have proper rest because going into labor is stressful and is a vigorous job. So you need to have proper rest. You need to sleep. You need to relax your mind, just like I explained before. You need to take things easy. You need to take so many things away from your mind. Things are difficult. You are thinking, we've not gotten this. How are we going to do naming ceremony? But thank God, most churches now, they take it easy. Whatever you have is what they will use. The most important thing is that you have given birth safely without any problem. So don't allow anything to bother you. My husband just lost his job. How are we going to do this naming ceremony? Whatever you have, please do it. Don't bother yourself and make sure you have enough rest. Then gentle stretching. If you cannot go for a walk, you cannot do any strong exercise, at least you can stretch your body. You can do like this, even sitting on your bed. You can do like this. Stretch your legs is also part of sleep and stress management. Then warm bath. You can want to take your bath either in the morning or in the night. Take a warm bath and wear a very beautiful and 100% cotton night wear to go to bed. Then if you have faith, you're a woman of faith like me, after taking your bath, you want to sleep, make sure you pray. Prayer, because you have faith in God and you believe that there's nothing God cannot do, which is very true. Pray in the night, pray before you sleep, pray in the morning, and commit yourself and your baby unto God. Even your pregnancy, you lay your hands as a Christian, lay your hands on your tummy and pray. I saw one video of a lady. Oh, I love that video. She was in the labor, she was praying. She didn't even know the husband was filming her. She said, my baby, she had already known that she was going to give birth to the baby. Say, my darling prince, you will come out safely. You will not stress me, I will not stress you. And I'm going to have you like the Hebrew women had their children in the Bible. You are going to come out as a whole human being. You will not be deformed. You will not have cerebral palsy. She prayed her heartfelt prayer for our unborn baby. So as a Christian, as a Muslim, that you know that there's someone out there that you reference, commit yourself and your pregnancy unto the Lord, and you will see his hand upon you. Then creating your birth plan. This includes the delivery method. Just like I told you, there's a way you can create your birth plan with your doctor and your midwife. If they know that this your pelvic is small, or you have cephalopelvic disproportion, they would have told you, and this can also be part of your delivery, your birth plan. Is it CS or is it vagina, or is it with minimal intervention? We have also forceps delivery that a doctor that is well experienced can use it to assist. We call it assist assisted delivery, we have vacuum that we can put on the baby's head and pump it, and the baby will be drawn out. So it depends on what the birth plan you and your doctor and your midwife has. So this one also can work. Then we are going to also talk about pain relief during labor. Yes, I remember that time we used to give analgesic, because some women will be having, the contraction will be so consistent that there is no time she can rest. And we don't want her to rupture. We don't want her to even see somebody in pain. The doctor can write that you can use this to relieve just for some time. Not that the pain can never go because you want to have a baby. We teach you breathing exercises. In some other country out there, they use epidural, but I don't think that one is common in this part of the world. We prefer to go into labor and have our kids, but abroad they use epidural analgesia. Then we have warm compress can be put at your back. That's why I said that your mom or your husband, you have towel with warm compress. They can help you to place it at the lower part of your back or the lower part of your abdomen, just for it to relieve you, to be relieved of that labor pains. It also helps. Then movements also. You see some women, they can tell them to walk around the ward or around the hospital area, around the maternity area, just for her to get some relief. Some do, and it helps them. So then you have to also know who will be in the room. I think I've spoken about that. The immediate skin to skin contact after birth. This will also be discussed. As soon as you bring your baby out, the cord is separated. We place the baby on your chest for initial bonding with you, and for that baby to be able to establish its own breathing, and also to help the heart to function well. As soon as that baby is delivered, the baby will be put to skin to skin. Then cord clamping preferences. Is it your husband that will cut the cord, or you want the healthcare providers to cut it? This also will be discussed. There's some newborn procedures will also be explained to you, and care of your newborn will also be explained to you. So, and we also encourage you to be flexible, because birth rarely follows a script, mama. Not that you be stiff. Birth does not follow a script. As it comes, so you follow it. And sometimes you don't, that time I was working, we put them on to lie down flat on their back to deliver. But there are so many positions that you can use to deliver. You can squat, you can sleep by your side. You see in the abroad, some of them even deliver in the water. So whatever thing that you feel that you have any question, even as you are discussing this birth plan, your fear, questions, please ask. Don't be shy, don't be scared. Ask questions, because when you ask questions and these things are well explained to you, it goes a long way to help you also. Then what are the warning signs not to ignore at the later part of your pregnancy, especially for the new moms? Severe headache. You are always having severe headache. On this platform, I've talked about pregnancy-induced hypertension. So you have to be very careful. This battery is low. I pray it will be able to take So blurry vision, decreased fetal movement. These are the signs that as soon as you feel these signs, please don't ignore them. Go to the hospital to see the doctor. Heavy bleeding. In fact, in pregnancy, any sign of bleeding, you have to go and see your midwife. You have to go and see your doctor quickly. So you are bleeding and it's very heavy. It may be a case of placenta previa, and it's an emergency case. Severe abdominal pain. It is not normal. Leaking fluid, that is draining like all before time. Your amniotic fluid is leaking, and that amniotic fluid is what the baby is staying in, that is helping the baby to stay floating in it, and now it's leaking. You need to go to the hospital. High fever, swelling of face and hands may be a sign of preeclampsia, still part of pregnancy in this hypertension. In fact, you see swelling of face and hands, severe headache, blurry vision, they are all signs of preeclampsia, pregnancy-induced hypertension. So always trust your body. If something feels wrong, seek help immediately. Every time I always say that to my gorgeous pregnant mamas. Always trust your body. If something feels wrong, seek help immediately. Please, this is very important. So I think this is the whole topic. If you have questions, you can drop it in the comment section. Let me end this one. So question and answer. You can drop any question you have about this case. So you can see that it's a very interesting topic. So recap major points quickly. Then I encourage you. Your body is doing something magical, mama. And I'm opening the floor for questions and answers. And if you want to come into my DM to ask me questions, my DM is always open. You can always come to ask questions, and I will do justice to it. I hope you love it. I hope you enjoy it. It's question time. So I talk about today preparing your body for a smooth and safe delivery. So I talk about what you should learn, physical preparation, mental preparation, and so forth, and so on and so forth. I also talk about understanding your body in late pregnancy, what happens to the body before labor, why preparation is important, pregnancy nutrition for a smooth delivery, foods to avoid, supplements to discuss with doctor, body preparation and exercises, pelvic, so many things, perineal massage, and mental and emotional preparation. Then talking about creating your birth plans with your doctor. Then I also talk about warning signs not to ignore when your pregnancy is at the advanced stage, the third trimester. These are the things, especially for the new mom. You don't have to joke. You don't have to wait. As soon as you see that something is off, please go to the hospital. Go and see your midwife. Go and lay a complaint so that you'll be checked. And this will prevent any fatal complication. So I hope you enjoyed it. Thank you so much for staying. Thank you for your likes. Thank you for your words of encouragement. Thank you for subscribing to my channel. Thank you for follow. Thank you for your comments, and I really appreciate. And I also said that you can ask me questions, even if not on the live stream. You can come to my DM, ask question, whatever you want me to talk about, or you have a topic that has been bothering you that you don't understand, but you want me to say something about it. Please, you can come to my DM and ask me, and I will do my best. And if you are a nurse or a midwife and you want to, co-host with me, nobody knows it all. I'm not the most brilliant midwife or nurse. You can always come. Are you a retired matron that wants something? You don't just want me too. I'm retired, but I don't just want to stay without doing anything. So I come online every night to do this, and I've been enjoying it. At least I'm saving a soul. Yes, most people don't like this kind of thing. They prefer where they will be shaking their bum, where they will be doing all those things or talking about relationship. Those things are good, but this also is part of our life, and it's very important we talk about it. Pregnancy is not something that you just, talk as if it's not important. It's important. Okay. Yeah. So if there are no questions, I think we can call it a day. I'll see you some other time. Thank you. Good night. Okay.